Clinical training video for Exion Fractional RF Applicator. This video will demonstrate the proper Exion Fractional RF treatment technique. Always read the user manual before using the Exion device. This video does not replace training led by authorized specialists. Prepare all necessary accessories for the Exion Fractional RF treatment. Select the correct disposal tip based on the patient's skin type. Ask the patient to remove all jewelry, such as earrings or necklaces, from the treatment area and any metallic accessories, including piercings. Consult the user manual for complete information about treatment contraindications and precautions. It is necessary to apply the neutral electrode on the patient's back before performing the treatment. Remove the protective sheet from the neutral electrode. Make sure the skin is clean and dry. Stick the electrode securely to the skin and make sure that it is in full contact. To assure complete contact, rub the electrode on the skin for several seconds. Place the electrode on the patient's back. Never place the electrode across the spine. Connect the neutral electrode to the neutral electrode's cable. Clean the skin to remove any makeup or other cosmetics. Treatment area should be free from hair. Shave treatment area if necessary. If needed, you may apply numbing cream. The time for the cream to stay on the skin depends on the cream's manufacturer's guidelines and the concentration of numbing ingredients, the patient's sensitivity, and the parameters used. Always follow the manufacturer's instructions for the specific numbing cream. Post-anesthesia, wipe off the numbing cream with a dry gauze pad and clean the treatment area thoroughly. Ensure that all numbing cream has been removed. Clean the skin with 70% alcohol and allow it to dry thoroughly before the treatment. Detach the protective cover by pressing both grooved grips while pulling the cover from the applicator. As this disposable tip is sterilized, always check the conditions of the tip packaging before use. Do not use the disposable tips if the packaging or the tip itself appears damaged or the sterile barrier is compromised. Attach the tip in the direction so that the middle protrusion on the tip follows the middle gap on the applicator. Set the treatment parameters and press the play button on the main unit screen. Perform treatments on several test spots to verify the set parameters. Adjust the treatment parameters according to the patient's feedback and skin reaction. Place the applicator perpendicularly to the treated area. Use the firm pressure to ensure the applicator tip is in full contact with treated skin. Press the applicator trigger button. The radio frequency emission is indicated by an audio signal and a blue flashlight of the illuminated tip. Do not lift the applicator off the skin until microneedles have fully retracted. Apply pulses uniformly over the treated area. Place each pulse directly next to the previous one. Aim for an overlap of about 25% between each pulse to cover the border of the applicator adequately. If you suspect the presence of impurities on the microneedles due to the smell of burnt tissue or unexpected treatment behavior, press the cleaning mode button. In cleaning mode, pressing the trigger button won't release the RF energy. Start cleaning by double pressing the trigger button to perform a few cleaning mode shots into the soft cotton cloth moisturized in 70% alcohol. Repeat until the needles are clean. Push and hold the trigger button to eject the needles to their maximum length. Visually check the cleanliness of the needles. Make sure the needles are completely dry before continuing the treatment. Minimal to substantial erythema and edema are typical endpoints of the treatment. Small beads of blood at contact points might develop during the treatment. If untreated gaps on the treated skin are visible after the full area treatment, then they may be retreated immediately. When it is desired to reach the subdermal layer, adjust the needle length accordingly and turn on the extended mode. The technique when treating the body is the same as when treating the face. When the therapy is finished, remove the used disposable tip and discard it. Put a protective tip back on the applicator before putting it back on the stand. Disposable tips are for single use only. They must be discarded and replaced by a new one after each treatment to prevent cross-infection between patients. The following are some common mistakes that may have an impact on therapy efficacy. Poor applicator contact. Applicator tip not kept perpendicular to the treated area. The applicator is moved before the needles are fully retracted. The cleanliness of the microneedles is not regularly checked. Impurities, burn debris are presented on the microneedle surface. Area over the eyebrow is treated. Treating over the globe of the eye.